Good morning, good afternoon, good evening, my fellow YouTubers, Facebookians. As you know, I did my daily blog today, but before we get into details, I was just about to capture the moppe. So anyways, first I want to say outright, because this video is not really a video I do that often about things. I usually talk about my problems with doctors or what's going on. This video was a video suggestion, which I said I'd get to it as I'm a minister of God, and I will get to it today. So here we go. So I just did my redid my lipstick. So Anywho, first I want to say thanks to my sister for the nice package box that she sent me and Aaron. We got cookies and we got Buckeyes. Oh yeah, I'm looking forward to eating them. I had 2 cookies. They were really delicious. Very delicious. So anyways, this topic is going to be about, and Aaron already knows about it, and he doesn't support this video because, well, it's not a topic he wants to discuss, but I'm just going to get this out of the way. So, first of all, this video was requested by Norma. I'm thinking Norman from A River Runs Through It. Norma has asked stuff about what needs to be done to prepare for sex reassignment surgery. First one is a big one, and that is, and as Aaron would say, to be mentally ready for the severe pain and anguish that you got to go through before you can even think of having surgery, And that means following the SOC 7, which is the standard of care of 7, edition 7. And that, to get it, you have to, first of all, be prepared mentally. Now, I will get into the mental part in a second, but let me just read you a little bit of the SOC 7. Surgical treatments for gender dysphoria can be initialized by referral, 1 or 2 depending on the type of surgery, from a qualified mental health professional. The mental health professional provides documentation in the chart and or referral letter, the patient's personal and treatment history, progress and eligibility. Mental health professionals who recommend surgery share the ethical and legal responsibility for that decision with the surgeon. Okay, one referral is for a mental health professional is needed for breast chest surgery, mastectomy, chest reconstruction, or augmentation mammoplasty. 2 referrals are for a qualified mental health professional who independently assess the patient and are needed for genital surgery, i.e. hysterectomy, salpingo-oophorectomy, orchiectomy. Genital reconstructive surgery is the first. The first referral is the patient's psychotherapist. The second has to be a person who has only an evaluative role with the patient. 2 separate letters or 1 letter signed by both, if practicing within the same clinic, may be sent. Each referral letter, however, is expected to cover the same topics in the areas outlined. So, the recommended content of the referral letters for the surgery as follows. Client's general identifying characteristics, results of the client's psychosocial assessment, including any diagnosis, the duration of the mental health professional's relationship with the client, including the type of evaluation of therapy and counseling to date, an explanation of the criteria for surgery has been met, and a brief description of the clinical rationale for supporting the patient's request for surgery. Then, number 5, a statement about the fact the informed consent has been obtained from the patient, and a statement that the mental health professional is available for coordination of care and welcomes a phone call to establish this. Providers working with multidisciplinary specialist team, a letter may not be necessary. Rather, the assessment and recommendation can be documented in the patient's chart. So this is just for that. Hormones, you got to be on hormones as well. And I think I would like to ask something right now. For trying to get surgical intervention, from what I understand, for GRS and stuff is you have to have a history of physical with mental history of previous surgeries related to or in preparation of sex reassignment transition in the presence of status of any medical conditions, medical surgical office visit notes or consultation notes, surgical procedure charts, primary diagnosis of persistent gender dysphoria by a qualified mental health profession such as a licensed psychiatrist, psychologist, or other licensed physician experienced in the field, the incongruence between the beneficiary's experience, expressed gender, and their assigned gender, or strong desire to be rid of the primary or secondary sexual characteristics of their assigned gender, clinically significant distress or impairment in social, occupational, or other important areas of functioning due to persistent gender dysphoria, start day of living in the new gender role, and documentation supporting continuous living a new role for a period of 12 months or more, medications including start date of hormone therapy under supervised of a physician or documentation supporting contradictions, any physician-to-physician communications, independent evaluations, with one being provided by a doctorate degree, evaluating the mental health status, comorbid mental health conditions, and the beneficiary's understanding of the permanencies of transitioning surgeries, and an ABN that you sign for paying out of pocket if you don't have all the insurance. And this is just for the insurance claim to claim it. Now that we got this out of it, the proof for insurance, I don't know what insurance Norma has, but for Medicare basically will cover it on certain grounds. I have the Medicare info right here, and it's basically medical need and standards of care right here, where transition-related surgeries will be made individually on the basis of medically need. So, primary care physician could say a person's medically need, but you got to get that done, and they limited the surgery as a experimental, so it's transition-related surgeries will be individually on the basis of medical need. So that means most surgeries are covered, but telling the doctor, well, this is medically necessary is different. So now, for an example, I would like to have Aaron come in here for a second. He's cooking dinner. The question, fine, then give me the answer. Statistically, how long before you can have surgery with hormones and other therapy?
You usually need 2 years of hormones and 2 years of therapy.
So,
a year of therapy to get hormones.
So, Aaron said, just to qualify to get onto hormones, you need a year of therapy. Then you need 2 years of therapy alone just to get your referral for surgery. So then you still have the real life test, which is 1 to 2 years. When I was transitioning, and I'm still am, it was 2 years. 2 years of transitioning for the real life test. 2 years on hormones before you can have any type of surgical intervention. So 2 years plus the time you got, and that does not include all the referrals not referrals, all of the consultations you had to go to for psychiatrists and psychologists just to get your letters. Now, I have my letters given to me by my primary care physician, so I can actually have my surgery done in Thailand, which, is a big step. Aaron, as he just said, is about 3 years before you can even have gender intervention or gender,
And during that time, therapists usually don't work with you to make sure that this is right for you. They don't want you to have any regrets, but they usually rubber stamp anymore. And I don't know what to say about that. Something she might be missing is when you're coming up on your surgery date, you got to get your doctors in line. You need to get your therapists in line because you have to have your referrals within like 60 days of
surgery.
Or 3 months of surgery. You have to have your heart checked out. You have to have a cardiac stress test.
Yes, that's the thing I was just going to say is...
And you got to have that done within a month or so.
Here, let me give you the list, as he just said while we're talking about it. Here we go. So, before I go, this is it. You need your lab work, okay? When you're going before surgical intervention, I have a surgery day. As Norma was asking me what is going on that causes me to be depressed, well, I'll explain that at the end of this video. So, the only thing left for my surgical intervention is, besides the nurses getting back to me, which Mr. Aaron is going to be contacting them by the end of the month, so here's what you need. First, you need labs. You need lab works. You need a CBC. Hold on. You need a CBC, CMP, PT, PTT, INR, chest X-ray, EKG, and a UA with urine culture. The EKG is fine as long as you had a stress test recently within 5 years. I know this because of it. Chest X-ray to make sure your lungs are clear for anesthesia. The medical and cardiac clearance has to be done with 30 days of the surgery date. The lab results and clearance are only valid for 30 days. So this is part of the sex reassignment surgery.
Now, there's another little thing that she's forgetting here too. Not only do you have to worry about all this stuff, but you're going to have to save up some money because you're going to have to pay your own travel expenses, including hotel room and food while you're there. And you might be fortunate enough to get it all done in one trip, but you'll need to stay in the town for almost a month. And finding a low-cost hotel for that long is not an easy feat.
Yes.
The lowest I could find was something like $250 a week.
Hold on, we're talking about my surgical doctor. We're not going to give the towns because I don't want that. But
we just looked into another town for something else, and we found hotel rooms for $50 a night.
No, actually, I found it for $40 if we go to the Hojo.
I don't want to go to Hojo.
Anyways,
the other thing is try to find a place that has a weekly rate. But
anyways. For example, this here in my hand is my American airline ticket. I bought my ticket. I followed diligently. Let me just say I followed diligently with the requests of what Aaron and what the nurse's assistant has told me. So technically, my psychiatrist knows we've already done it. My therapist has known we have done it. So technically, it's all in their head. Because I requested something apparently that was not covered by insurance. Actually, this letter here, you need to know, it's highlighted. It says, this means that coverage decision for transition-related surgeries will be made on an individually of the basis of medical need. So that means right there, whatever the surgeon thinks. My primary care thinks I need breast implants already. My primary care physician thinks I need gender reassignment surgery. Excuse me, I didn't want to wear those again. So technically, when it comes to the surgeries, it's not just like you get laid on a table and they put breast implants in you, redo your face and give you a vagina and send you out the door, destroy your breasts, remove your ovaries and uterus. This is stuff that you have to go through.
Loop time's like 6 months to be able to walk.
Yes, exactly. 3 to 6 months just to walk. Now, here's the other problem with it. Now, if you look at this, and this is something I want to show Norma and the rest of you people that are considering SRS. This is 6th page. This is a psychiatrist or a psychotherapist analysis that was sent to the surgeon. It's 6 pages, and at the end of it, it said it recommended me mentally. I'm physically fit, and I will be physically fit for gender reassignment surgery, a sex reassignment surgery, also known as surgical intervention. That right here. Now, let me put it to you this way. Just so I can get the breast augmentation done, if the doctor delays me, the surgeon and the 2 nurses, because they don't know what they're doing, Aaron will be talking to them by the 30th. This here is a letter sent to the surgeon itself. It says copy in 3 places. It basically states right here that my depression is in remission. But no, it isn't, because the surgeon, and I'll explain this in a minute, it says, I'm a good candidate for surgical procedures mentioned above. Yeah, right there. And they will work with me to support after the surgical procedures. And then it says, my only disability right now is gender dysphoria, which now it's depression. So she recommends me the following surgical interventions, you know. And that is, the surgical interventions. Top part says, for prospective gender surgery, face surgery, breast surgery. So, right there. So it says right there, all of this is good. The bottom says surgical intervention. So there you have it. Now, Aaron forgot to mention this, which I will get into. This is a letter that you have to have before you have surgery.
What?
Do you want to say it about the endo?
Oh, yeah. You need a letter from your endocrinologist that basically states what hormone regimen you've been on, how long they've seen you, if they know that you've been on other doctors, or how long you've been on meds, and what they've done to change, correct, etc., and why. So, it's not really a referral letter, even though hers gave a referral too.
Yes. In the old days,
the endo needed to refer in the old days.
Yeah, exactly.
But in the old days, you also had to take a written test, which I've gone through. And you also had to sit into a group of specialists who would review you, basically, and they would make the decision whether you were qualified yet or not.
Now, I just want to say, so I can wrap this up, and Aaron can do it if he wishes, but as you know, I just said, this is the psychoanalysis. Is that psychotherapy analysis what they call this?
Yes.
Psychotherapist analysis. There's the referral information for surgery. Because they weren't happy with it, this is the psychiatrist referral. So we got 2 now for billing purposes. Hormone doctor right here is the 3rd one. So 3 letters. This is what I have to go through. So you, Norma, and others. And this is the therapist's own letter for surgical intervention. Just for the billing. I've read everything else to you. Now, so me and Aaron can have dinner and we can get this over with. Please explain really quick to Norma why the depression, since she asked of what it is with the surgeon.
And hi, Norma.
And no, Norma, he is not single, so you can't ask for him because I know you like men.
Anyways, Rita's going through a bit of depression right now. May not seem it right now, but that's because she just got Christmas cookies and there's all that chocolate. You know, chocolate cheers anybody up for a little bit. Anyways, what basically happened with her doctor is they said that she'd be covered on Medicare Parts A and B. And they said they convinced her to do her breast augmentation with them. All of a sudden, just as we're getting about a month away from, having to go through this all, they contacted...
2 months, Aaron, 2 months because we still
almost 2 months. You only had to make it through January, and we only found out a few days ago.
Yes, the 14th.
So, anyways, that's interesting. Sorry. I'll tell you what's interesting in a second. Anyways, the doctor's nurse, the clinic
the
administrator basically contacted Rita after Rita was supposed to ask her for their address, and that was pretty much all she needed to ask her because needed to know for taxi, an itinerary. And then she all of a sudden drops a bomb on us saying they only accept Medicare Part C. Even though she didn't say it that way, she said that whatever Medicare does not approve at the time of your consultation, you will have to pay that day to have your surgery.
But the doctor stated...
And the doctor said that you would not need to do so. I already explained that part, so just stay out of it.
Yes.
Otherwise, we're not going to have dinner more.
All right. Sorry.
Okay? So, well, you shouldn't have made this video right now. But anyways, the thing is, we haven't heard back from their nursing staff after we've asked some questions about why the doctor would say one thing and all of a sudden everything's changed. Which is it? We can't get a straight answer. They're not returning calls. They're not returning emails. I've emailed them. Rita's emailed them. I've called them. Nothing. So it seems like they've just decided that that was a way to blow off a patient or whatever. And now they're decided they're not going to talk. So, of course, she's going through some depression because we've talked to a couple other doctors that take Medicare, and they said she's too disabled for them to do anything with, even though the only disability she's got is learning disabilities, which doesn't disqualify her from having it. What does disqualify a person from having it is having something like schizophrenia, borderline personality disorder, dissociative identity disorder. You can leave the emails alone. I know about them.
Right there, the doctor stated that. Whatever,
yes, I know.
Right there, it's talking about Part A and Part B billing, and then he says outright, I do not believe Medicare covers FFS or breast augmentation. Check with my medical assistant or the administrator on top surgery. Realize Medicare does not require pre-approval, and if we end up doing a case that is not paid by Medicare, then you're responsible. This is the surgeon's own words. Now they're telling me I need Part C?
Yeah.
Makes me wonder.
And it's not that they're telling you need Part C. They're telling you you'll have to pay whatever they don't pay, don't agree to pay at the time of your consultation, which sounds like pre-approval. And if you need pre-approval, you have to have an Advantage plan because Advantage plan is what pre-approves. Medicare doesn't approve until 30 days or 90 days after whatever procedure you have done.
Yeah, so there you have why I'm depressed. Now,
I gotta finish. I also stated that there was something interesting, and if you look where this spoon is pointing, you could see what looks like a little green globe. But there is no green globe there. It's actually like some reflection from this light up here that's coming down here. I just found that interesting.
Anyways, there you have it, everyone. It's time for lunch or dinner. So please add and subscribe if you like. Please post comments, leave feedback, suggestions. And there you have it. This is all the crap you got to go through in the United States. I don't know about other countries, but in the U.S., this is what you got to go through. So thank you, and may God bless you all.